Well, we have the first medical school to fully incorporate AI into its curriculum and teaching. And thanks to CBS News for this story. They talk about how one medical school is fully embracing AI. The Icahn School of Medicine at Mount Sinai in New York City has become the first in the U.S. to incorporate AI into its doctor training program. And one of the people they talked to is Faris Gulamali, who is a medical student. Gulamali says he uses ChatGPT to help him prep for surgeries and to improve his bedside manner when explaining complex diagnoses to a patient. So this is not the regular ChatGPT, by the way. I'll talk about that in a second. Gulamali says the biggest help has been in helping him reframe these tough patient conversations. The use of AI in sensitive fields, such as medicine, has brought up concerns of privacy violations. And OpenAI said it is collaborating with universities and medical schools like Mount Sinai to ensure strong safeguards are in place to protect students and patients. So what they're using is ChatGPT Edu. It's built to be fully compliant with HIPAA, which is the law surrounding privacy of all medical records here in the United States. In other words, HIPAA stops medical information from being disclosed, supposedly, without the express approval of the patient. The reason I said supposedly is there's been a number of hacks exposing this kind of information. So OpenAI's VP and General Manager of Education is named Leah Belsky. She says, I think in medicine and in health in particular, it's essential that students learn how to use AI and use it safely. What we're really focused on is making sure that there is equitable access to AI. What she means by that is, while it's not crazy expensive, for the better models by ChatGPT, you have to pay a monthly fee to use them, and not everyone can do that. For another PhD student at Mount Sinai, the AI tool serves as technical support on complex research projects. So medical students like this are not going to practice medicine. They're doing medical research, often for pharmaceutical companies, which are very seriously going all in for drug development on AI. So this student's name is Vivek Kanpa. He gives me a pseudo-clinician-style mentor as well as a pseudo-software engineering collaborator to fix bugs in what he's developing. It's not only the students who say AI is changing the medical field. Dr. Benjamin Glicksberg, one of the faculty at the Icahn School, called it the most remarkable innovation he has ever encountered. I'll explain why in my comments at the end. It changed everything, Dr. Glicksberg said. I think it's changed how I interact with my students. It's changed how I mentor and even try to innovate myself. Now I'm going to be adding to what he said. The professor also said AI tools can be a real time saver. Without a doubt, automation is a huge time saver, especially because the healthcare field until recently was very manual with paperwork or typing stuff into a computer. Growing with it as opposed to fearing this thing and holding it in this scary sense that it's going to replace us, I think it's really instrumental to be heavily involved with it, said Kanpa, the student. So here's my comments. Very interesting story. Number one, yes, as I've been saying here, just like the student Kanpa said, the people who are going to thrive in the medium term are people who fully embrace AI and leverage its power. The people who do not learn AI are going to get run over. This will soon be true at almost any job. Number two, this is a very short preview of what I've talked about before, that AI is going to wholly change education over the next 10 to 20 years. Now, why so long? Because the educational field is very conservative by nature. As this article demonstrates, this is the first medical school to fully incorporate the technology into the curriculum and training. So by its nature, education is slow to change and slow to adapt, but it will have no choice, and education will become highly personalized to the individual. And that will be a game changer for many, many kids who today cannot do well in the educational model that's still in use today. But finally, AI in the medical field is not just about medical education at all. I've talked on a short very recently that many surgeries are now robotic. In the midterm, meaning 5 to 8 years, most of them will become robotic. Why? Because both AI and robotics and sensors, for that matter, are in an exponential development phase where the pace of improvement is constantly increasing. So improvement is going to be extremely rapid. And my viewers know that AI is already much better than humans at certain things in the medical field, like reading X-rays, MRIs, CAT scans, etc. And the third point is that over the next 5 to 15 years, AI will displace people from some of the current jobs that are in the medical field, but not others. On the upside, we can expect miraculous things to cure intractable disease, courtesy of AI, during that time period. On the other hand, if by 2030 they're making millions of humanoid robots a year, it is not reasonable to think that robots won't be doing all surgeries in the near future, just as one example. So it is not being straightforward to ignore the fact that there is going to be significant job loss this time in white-collar and professional occupation, because there is. And this is going to be a huge shock for some of the highest-earning people in our society. The titans who are developing AI and robotics these days know this. A few of them have talked about this, but it is going to happen. Your best defense is to pick a career that requires the human touch. And there's plenty of those in the medical field. Home health care, nursing, physical therapy. There's your three right there quickly. No one is going to want a robot doing that in the near future. So the path of AI-resistant careers is things that still will continue to require the human touch. But it is clear, as a final comment, that education has to change. And of course, AI should be incorporated into all educational environments. I previously did a video about the All AI School in Houston, Texas, or Austin, Texas, one or the other. But this is what's coming. And the kids at that school were testing in the 90th or higher percentile on the standardized test, meaning it's better than many of the traditional schools. So all these changes are coming and absolutely nothing will stop them. Nothing. So prepare yourself. Thanks so much for tuning in. We'll see you next time. Please like, subscribe, and share this video. Really appreciate your support and help. Also, please support us on Patreon. We need your financial support to continue to grow the channel and bring you fascinating stories that will impact careers and keep you ahead of the tsunami of AI job loss. Thanks so much. Take care. We'll see you next time. Bye.